Welcome back to See Hear Feel. Today is part 2 of my conversation with Dr. Olayemi, who goes by Yemi Sokumbi, MD. If you didn't have a chance to listen to the first part of our conversation, a little bio here. Dr. Yemi Sokumbi, MD, is a dermatologist and dermatopathologist currently at Mayo Clinic in Jacksonville, Florida. She is medical director for business development and also teaches numerous medical students, residents, and mentors, many of them as well. She did her dermatopathology fellowship at UT Southwestern and was chief resident in dermatology at the Mayo Clinic College of Medicine. She's won numerous awards and is highly successful. I emphasize that because I hold her in high esteem, and today we're going to talk about failure. We'll jump right into it now.
I'm an immigrant. My family's originally from Nigeria. I moved in my teen years, and my parents made tremendous sacrifice for me to have this life. And I was struck with the fact that I've carried this, and this wasn't by no fault of my parents, but this significant fear of I couldn't mess this up. I couldn't fail. I couldn't disappoint. They've made so much of a sacrifice. I have to be worthy of their sacrifice. And then you add the fact that I've chosen a profession to be in healthcare, a profession that, as we all know, does not tolerate failure. So you combine my background, how I grew up, you combine the fields that I chosen, and you can imagine that both combined together really just led me down a spiral.
Yeah. You mentioned being afraid to fail. You said you had a fear of failure, but you've learned to lean into it. Can you talk about that a little bit?
Yes. My fear of failure, sharing from my background, I should also mention, if it wasn't implied when I said I moved from Nigeria, that I'm a Black woman. The stereotype threat of that was huge in my failure journey. For those who are not familiar, stereotype threat is the concept by which you risk feeling that a negative stereotype about who you are, whatever an identity is for you, will truly come to pass. And that leads to significant stress, can lead to anxiety, it can affect performance, and it does actually affect performance. And so for me, because I was working so hard, Christine, I didn't want to fulfill whatever stereotype folks might have for my demographic. I didn't want it to be reflected in an outcome. So I overcompensated by working so hard. I used to joke and say, I can outwork anyone, because I was just so keen of all of the stereotypes. One simple one that doesn't even affect academic performance, you might have heard of the angry Black woman stereotype. And that couldn't be further from my personality, but I actually started questioning that. I'm like, is my personality so skewed to make sure that I don't fulfill a stereotype? It might sound very basic, but these are the kinds of things that come to, that you think about. So my fear of failure was like, I can't fail. One, because remember, I had the background with my parents and sacrifices they made. So that's an immigrant challenge. But then I have this other one here saying, at the Mayo Clinic, they don't have too many residents who look like me. So I have to be a model resident. So I cannot fail. I have to be so good. I have to be the best. So that burden does not give you permission to recover. You feel it's the end and that the failure will define you. It was key that I separate my identity from the work. That separation enabled me to tolerate failure.
Yeah. And when you fail, sometimes the burden, especially when you're feeling stereotype threat, is not only that it reflects on you, but it reflects on that whole group of whatever you're representing.
The entire demographic, you feel like you're carrying the burden on your shoulders, and you have to put your foot forward so that maybe others like you can find space, can also thrive. And at the root of being fearful of failure, you have to understand that one of the things is that means I didn't really have compassion for myself. So it requires that you have self-compassion. It requires that you have grace for yourself, that you don't shame, you don't live in shame. Those are the things that you have to grapple with when you're dealing with failure. For me, I give people so much grace, Christine. I'm kind to folks. It's actually a core value of mine. I have compassion. And so it struck me that I wouldn't offer myself the same.
It's interesting that you say that. I believe you that you would, even then, you would extend a lot of compassion to others. I spoke to a couple of psychologists who research compassion and self-compassion. One of them studied other compassion, so compassion directed at others. Her graduate student wanted to study self-compassion. Through working with the graduate student, she realized that if you don't have self-compassion, you actually cannot really direct compassion at others.
Really? Well, there you have it. That's helpful.
Yeah, because you truly did have compassion for others, you were able to extend it
Directed my
to.
way.
Yeah.
And maybe that's one of the reasons, that's a key point to note, because maybe that's one of the reasons why this journey was also apparent to me, or the need for the journey was apparent. My awareness of it probably came from a place of compassion towards myself, like an attempt to save myself.
Yes. I do also think that the people that I think are sort of the meanest,
Yeah. That they're
whether
mean
at
to
work,
themselves too.
they're really mean to themselves. If you see them at a moment
Yeah.
where they're not happy with
Yeah.
themselves, they're pretty mean to
To
themselves.
themselves too. That's a good point. Like, I've never seen a person who is like mean to the world be like warm and fuzzy to themselves.
Right. Do you have any recommendation on how to overcome stereotype threat?
That's a deep one. First, especially if you're not from a majority demographic, you probably spend time being aware of what the threats are for your demographic. For my demographic, I talked about the anger thing, being a female and being Black. My racial demographic, there's of course always questions about intelligence and capabilities. And think about, if I were to say, well, how do you solve for that? It's a challenging one because the onus cannot be on the individual. Most people will respond to it by overcompensating. I definitely wouldn't recommend that because that has an untold mental burden that cannot even be shared. That's not an out. I have trainees that are my demographic, and I have many, many mentees across the board that I mentor. And I could say, just be you and do you and authentically be you and don't listen to the noise. That's another advice I could give. But I will say that, particularly from the lens of our specialty, dermatology, we know our specialty. We are filled with high achieving individuals. We have people who have board scores that you didn't even know the scores went to that high of a level. And so telling someone to feel relaxed and that all will be well, it's also actually an unfortunate falsehood because I cannot promise the outcome of that. I
Yeah.
truly can't. And so I have to say that I actually do have folks that I mentor that I tell this threat exists because you're performing at this level. It behooves you to work a little bit more because you need to, because now it's very different than actually even medical school, because now you've selected for the smartest of the smartest and they're all with you, and that people will compare you and you already have this extra baggage you carry with you. But then there are some individuals who do need to be told to give themselves grace because you can see the mental burden of trying to overcompensate, and that cannot be sustained.
Yeah. I think it's hard when you're trying to give advice or mentor someone who feels inadequate, like they're not measuring up, whether due to stereotype threat or an actual test score
Mm-hmm.
or evaluations they get that suggest
Yeah.
that they're not
Yeah.
performing well. How to try to make someone feel better about that when it's making them feel bad
Yeah.
and
Yeah.
making them not want to work hard. I think that's
Yes,
a really difficult thing.
I agree with you. But I think we can do a little bit more with our ability to be vulnerable, because I think that what can be validating for a mentee such as that is for you or for us to be deliberate in acknowledging our own common struggles and deliberate in acknowledging our own failures. We actually don't do a good job of that. We put a lid on our failures and we do a wonderful job of sharing and highlighting our successes. When you give a talk, no one spends time talking about what you failed at. Your bio is all the things you glow at. We're very good promoters of success, but we don't discuss failure. It's not in our norm. We hide it. It's why M&M conferences are not popular. No one wants to go to an M&M conference because it's a discussion of failure. But everybody likes a talk that allows someone to shine, that allows them to get reward. So we're a reward oriented culture. So that influences, if someone feels, well, how can you relate to my failure? There is a need for us to humanize ourselves a little bit more with the people we mentor so that we can be more relatable, approachable, particularly around the struggles.
Yeah, I love it. So fun to talk to you.
I've been looking forward to this.
What do you wish you had known earlier?
Yeah. The need to not strive for perfection. There's nothing to be gained by it, just additional psychological burden. Really, that's the key because it started for me way too early. I'm such in a different phase that how easy it is to share what I'm not good at, what I failed at. It's a different journey for me. I wish I had the freedom to do it earlier because it is so liberating.
Yeah.
It allows me to show up in my trueness. And when I make connections, like I made connection with you, it's with me. How liberating is that? Because you're meeting me.
Yeah. It's awesome. Do you have any final thoughts?
Yes, let's talk about our struggles a little bit more. That would be my challenge to the audience and to us, to our specialties, our subspecialties. Let's talk a little bit more about it. Let's be intentional. Let's humanize one another so that we can be more appreciative of one another. I think that it will allow us all, I alluded to this earlier, but it will allow us all to lean into our purpose in full awareness of our worthiness, fully aware that we're worthy. We'll lean into our purpose. And then when we show up for the hard work we know we all do day to day in our care of our patients, in moving our institution forwards, in moving our society forward, all of the things that I know we're all tasked with, that we all enjoy doing, it will allow us to contribute in those spaces from a true position of strength.
Thank you so much for spending the time to do this with me. I really, really appreciate it.
You're welcome. You're welcome. It was lovely to be in conversation with you.
Yeah.